Thank you so much for your interest in the Neuroradiology Fellowship Training Program at University of Virginia, and welcome to our brief virtual tour. We decided to mainly focus the tour on those areas in which you would spend the majority of your day-to-day time as a fellow. Please see our other videos to get a broader sense of our facilities and surrounding environs. Here we are in Charlottesville. You can see we're in close proximity to Washington, D.C., Richmond, Virginia, and situated along the foothills of the Blue Ridge Mountains and Shenandoah National Park here. Zooming into Charlottesville, you can see that the medical center is located centrally within the town, in close proximity to many family-friendly neighborhoods and the downtown walking mall here. Before we take a closer look at University Hospital, I'd like to point out this unlabeled structure here. This is the South Garage. This is where the majority of our staff are issued parking spaces. In bad weather, it's a quick jump across to the School of Medicine, and you can follow an indoor pathway to the Department of Radiology and Medical Imaging here. Otherwise, it's about a quarter-mile walk or less along Crispell Drive, into the back entrance at University Hospital, up one flight of stairs, and you're into the Department of Radiology and Medical Imaging here on the first floor. In this tour, we'll visit 6 spaces. The Neuroradiology Reading Room, here. The adjacent Moss Amphitheater, our main conference room here. An ancillary conference room here. And some of our clinical facilities. Our procedure CT scanner here. Our spine intervention fluoroscopy suite here. And one of our 2 neurointerventional suites here. Zooming out just a bit, you can see that radiology is closely situated to our newly renovated and expanded emergency department, where we have additional CT scanners and MRI scanners. Of course, we're close to the cafeteria and, more importantly, to Higher Grounds Coffee, which is excellent. The tour that follows was done in 360-degree video, so feel free to pause and navigate and browse and refer back to our Maze Map app to get more familiar with our facilities. Again, we truly appreciate your interest in our fellowship training program and hope to hear from you soon. Thank you. This is the main reading room in the hospital. This is a relatively open floor plan layout. It's easy to hear when interesting cases are being discussed or find an extra set of eyes to borrow on a tricky exam. You'll notice sidecar computers next to the main workstations at each desk. And this is so that you can log in during side-by-side case readouts, take notes or adjust reports, or explore the medical record for those crucial details to help you refine your diagnosis. This setup keeps workflow smooth and efficient, so hopefully you'll be able to see more cases than you would otherwise have over the course of your fellowship. Up front, you can see our reading room coordinator desk. The reading room coordinator helps to appropriately direct phone calls, can contact referring providers for you, help get IT involved if needed. This is all to help you stay productive and focused while you're here at work. Situated just next to our reading room is our consult room. This is an auxiliary conference room of sorts. You can use this for small group didactic sessions or for imaging rounds for our clinical teams. This room features high-definition flat-screen monitors that are ideal for displaying image clarity in this small space setting. There is full electronic medical record and PACS integration here, as well as e-conference capabilities. Maybe 40 feet outside of our reading room entrance is the main radiology conference room, the Moss Amphitheater. This is where we have the majority of our lectures, in-person didactic conferences, resident fellow case conferences, and so on. This is the main venue for our Tuesday fellow teaching conference and our Wednesday interesting case conference. This is the largest conference room in the Department of Radiology. It has 4 rows of tiered seating and ample room for social distancing, which has helped us maintain safe in-person didactic conferences within our program during the pandemic. We upgraded our projector in 2022. It gives us great image definition. Cases are easily visible from anywhere in the conference room. The ceiling microphones let remote conference viewers clearly hear the presenter and any questions or comments from the audience members. Just across the hall from our reading room is the core of our hospital CT scanners. This is the scanner we utilize most for our CT-guided procedures. This is the Siemens Edge Plus, a 128 detector scanner that was installed in late 2019. It has a number of features that make this a great procedure scanner. Intuitive controls for real-time imaging review, needle path planning, easy scanner bed toggle tools, and of course great technologists to make it all work. Each procedure room is fully equipped with all the commonly used biopsy devices, drains, introducers, etc. A short distance down the hall from our reading room are the Neuroradiology fluoro suites and the Neuroradiology nursing area, co-located for easy consent to procedure workflow. Room 3 is the smallest of our dedicated neurofluoro rooms, and this is the main procedural area for our neurospine procedures to include lumbar punctures, myelograms, lumbar drains, and blood patches. This room is equipped with a C-arm to give you perfect AP and lateral oblique views, as well as provide cranial caudal angulation to help you find the exact right trajectory to your target. The larger pair of neurofluoro suites are the angiography areas for the INR services. These facilities are also in the process of renovation, with the most recent upgrade to the Siemens Artis biplane equipment slated for installation. Of course, all of the interventional stroke cases and other cerebrovascular interventions are performed in these rooms. Additionally, spine intervention cases that require anesthesia are typically performed here because these rooms afford greater working area for both teams. Thank you so much for your interest in the Neuroradiology Fellowship Training Program at University of Virginia.